Hello and welcome to the PubMed Essentials Asynchronous class. My name is Ellie Swoboda and I am the Education Informationist at the Strauss Hill Sciences Library. And I'm so happy that you are choosing to watch this video and learn a little bit more about PubMed. So as we get started, I'll go over our learning objectives. So we're going to learn how to use the unique features of PubMed. What is it? Why would you want to search it? The next portion of the class will be the largest portion, and that's where we're actually going to perform some searches. So I'm going to show you how you can use advanced search options to refine your results and how to search in a way that's very comprehensive. Lastly, I'll show you how you can manage and utilize your results. So how you can save your articles, how to get them into EndNote, how to get access to full text, create alerts, things like that. So that's kind of the overview of where we are headed. And before we dive into all those things, I want to also bring your attention to the library homepage. So beneath this video, in the intro information about the video, there is a link to the library website. And I highly recommend that you start all of your PubMed searches from the library homepage. While we're here, I also want to direct your attention over here to this little Ask Us tab. This is the easiest way to get in touch with the library if you have questions. So obviously this is a class recording, so you can't ask me questions live, but if you want to ask me or just the library in general questions about PubMed or about other library services, the Ask Us tab is the easiest way to do that. So you can just click on the tab. If you have a quick question and it's business hours, so Monday through Friday, 9 to 5, you can fill out some information here, put in your question and start chatting with a librarian. If you have a more in-depth question or you want to set up a consultation or it's outside of business hours, you can click on this link here to fill out our form. It'll ask a little about you, and then you can say what you're hoping to get help with. And we will get back to you within 2 business days, although we're usually faster than that. So I always wanted to make sure, even though this is asynchronous, we want to help you. So please reach out to us. The other thing that you'll see in the information below this YouTube video is that we have a link to a guide that has a lot of resources for this class. And so it has all the slides I'm about to show you, and it also has the search matrix that we're going to be using. So be sure to check that out as well. So now that we've kind of gone over library stuff, we're going to go to PubMed. And so, like I said, I highly recommend starting all of your searches here. And the easiest way to get to PubMed from the library homepage is to scroll down, and over here under top resources and most used, you can select PubMed. And that's going to take us into PubMed. The benefit of starting from the library homepage is that then PubMed recognizes that you're affiliated with us, and it makes it just a little bit smoother to access the full text of the articles that you want to access. So that's my big reason for starting things this way. Now that we are here, that we're at PubMed, I'm going to give you a little orientation to what is it and why might you want to search it. So PubMed is a database of citations. It is one of the biggest. It has more than 35 million citations. Each time I give this class over the last 4 years, it seems like it grows by millions over each year. So it's very up to date and very big. It is run by the National Center for Biotechnology Information through the National Library of Medicine. And so it is a federally funded resource. It is free for everyone to access. And that's another reason we really emphasize learning to become comfortable with PubMed, because since PubMed is free to access, it will be able to serve you throughout your career. So if you're a student, after you graduate, you might lose access to some of the things that the library pays for, but you'll never lose access to PubMed. And regardless of what the institution you end up at, what they subscribe to, again, you'll still have access to PubMed. It's also available internationally. So if you study abroad or you work abroad, PubMed will work for you there as well. So it's a really great resource. What is it made of? So it has 35 million citations, and those citations come from kind of two big buckets. The first bucket is called Medline, and Medline is an index of journals that extends back to the 1960s, and journals have to meet certain quality criteria in order to be indexed in Medline. So things that are in Medline have reached, certain milestones and certain criteria that can increase your confidence in the quality of the stuff that's in Medline. In addition to Medline, there is a bucket of articles, citations, in what is called PubMed Central. So PubMed Central is kind of like the nation's institutional repository. What I mean by that is it is a place where if you receive NIH funding and it requires that your research be available to the public, if taxpayers paid for your research, they should be able to read what comes out of your research. One of the avenues for making things publicly accessible is to archive them in PubMed Central. And so that is another large pool of what is in PubMed. In addition to those two big buckets, there's also things that are called just some other random life science journals and a small collection of online books. So that's kind of the bulk of what is in PubMed, why you would want to search it. From here, we're going to dive into actually searching PubMed. So I have here a framework. It's called Pico. You might be familiar with it, which it stands for patient population or problem, intervention or exposure, comparison, and outcome. This framework can really help you to organize your question in such a way that makes it easier to search. Not all questions are going to fit into a Pico format perfectly. However, I hope you take away from this the idea that whatever you search, whatever question it is you're searching, it needs to be able to be broken down into core concepts to make it easier to search. I highly recommend writing your question down, even if you don't end up using a framework. It's just so much easier to structure a search if your question is written out and very clear of what you're searching for. The question that we are going to demo today, I've intentionally chosen kind of a dry question so that we can really focus on the method and not be excited to look at what comes up. And so our question today is, among healthcare workers, does hand washing compared to wearing masks reduce hospital-acquired infections? And you'll see that this breaks down nicely into a Pico format. So our patient population or problem, our patient population are healthcare workers. Our intervention is hand washing. Our comparison is wearing masks. And our outcome are hospital-acquired infections. So it breaks down quite nicely. From here, we will put these concepts into what we call our search matrix. Really, it's just a table in Word. And again, there's an editable version in the link below that you can use. And what this really helps you to do is organize your search in a way that is replicable, so you can share it with others and they can know exactly what search terms you used. It's also just useful for you to have a static version of your search terms. So if you start your search one week and then come back to it another week, you don't have to scratch your brain trying to remember what search terms you used. You have this nice documentation. The other thing that's great about this methodology is it's very comprehensive. It can really increase your confidence that the number of articles that we're finding is pretty close to the number of articles that are out there on your topic. So it's just a good methodology to use to be really confident. So what we end up doing is each of these columns gets a concept of one of the elements of our Pico question. And you'll notice that there are two rows for each of our concepts. And so there are two main places that we're going to search in PubMed. The first one is we're going to search entry terms and keywords. These are going to search things like titles and abstracts. The second thing is kind of unique to PubMed, and it's called MESH, which stands for medical subject headings. So medical subject headings are a controlled vocabulary, and they can help us to solve the issue of synonyms. So in the health sciences, there are oftentimes concepts that have multiple terms that could be used. So my go-to example for that is cancer. If you are interested, a component of your Pico question is cancer or patients with cancer, you will need to think of a lot of different synonyms because it can be talked about so many different ways in the literature. What is nice about MESH is that regardless of what term got used in a title or an abstract, if they used malignancies or tumors or carcinomas, in all those cases, if it's about cancer, it will get tagged with the official MESH term for cancer. So again, because it's a controlled vocabulary, there's only one official term for each concept, and it is predetermined. It's created by the National Library of Medicine, and it's applied by an algorithm that is used at the National Library of Medicine. So by finding that MESH term, we can search really efficiently. But unfortunately, there's a couple of downsides to MESH. So the first one is that not everything in PubMed receives a MESH term. So earlier when we were looking at PubMed, I talked about how there's two big buckets of what is in PubMed. Only the things that are in Medline will receive these MESH terms. So if you exclusively create a search with just MESH terms, you could lose or miss out on some potentially good articles on your topic that just aren't eligible to receive MESH terms. So that's one downside. The second downside is that MESH terms, I don't know if they're always intuitive. So in our cancer example, the MESH term for cancer is neoplasms. And that's just not always necessarily the first thing everyone thinks of. So that's why I'm going to show you there's a handy tool in PubMed called the MESH database that we can use to find the official MESH terms for the concepts we're interested in. So I'm going to return to PubMed. We're on the PubMed homepage. And if we scroll down a little bit, over here on the right under the Explore icon, if you click on MESH database, that will take you to the tool I was talking about, the MESH database that we can use to find the MESH terms we want to use. We will primarily use this search bar right here. It kind of works like a thesaurus. So if I type in cancer, it's going to suggest for me a variety of different MESH terms. And what's really nice is they're always going to have a definition underneath them. And so when I see neoplasms, I see new abnormal growth of tissue, malignant neoplasms, etc. That's matching what I understand cancer to be. So I think I've found the correct place. So I'm going to click on that MESH term. And I'm going to walk you through every MESH record is going to follow the same template. So if I scroll down, you can see there is a checkbox list of what are called subheadings. These subheadings allow us to focus in on a specific aspect of a concept. So if you were interested in the history of cancer or the economics of cancer, you could select that subject heading. And then when you use the MESH term with that subject heading, it's going to limit your results just to things that are about cancer and economics. So it's a good way to narrow something down. However, when you're initially doing kind of an exploratory Pico search, I generally don't recommend using these because our goal is to be a little bit more broad to make sure we're not missing any literature. So by not clicking one of these subheadings, we will get all of the subheadings. But again, not every searching situation is the same. If you're just running a really quick search, then I think that these subject headings can be useful. Next, we have this bullet point list of what we call entry terms. These are useful for two main reasons. The first reason is that if you receive a MESH term you weren't quite expecting, you got neoplasms, you read the definition, you're like, I'm pretty sure I'm in the right place. If you come down and look at the entry terms, if the term that you searched shows up in this list, it's an indication that you're in the right place because this is a list of synonyms. And if cancer, the term you searched, is listed as a synonym, most likely you're in the right place. The other reason this list of synonyms or entry terms can be useful is it can give you some ideas of other terms you might want to use to search titles and abstracts. So like I mentioned before, not everything in PubMed receives a mesh term. And so that is why we have that second row, right? We also want to search entry terms to find those things that don't have mesh. And that's where this list can be a good kind of jumping off point. You are the subject matter expert. So if there are terms on this list that are outdated, you don't have to use them. There also might be terms that aren't on this list that you think are relevant. You are empowered to add them. So this is just kind of a jumping off point, but I still think it can be useful to get you brainstorming, get the juices flowing, thinking about synonyms for your concept. The last thing I want to show you is the mesh hierarchy. So a thing that I think is really neat about mesh is that instead of just being listed alphabetically somewhere, mesh is hierarchical, meaning there are relationships between the different mesh terms. So all of these blue underlined words and phrases are mesh terms. And you'll notice that as we move from left to right, we go from broad to narrow. So you can see neoplasms is quite broad. It's only under diseases category, but then under neoplasms, we have things like cysts. Under cysts, we have things like arachnoid cysts or bone cysts. If you see this little plus sign, that means that underneath that mesh term, there are yet further narrower terms. So presumably there are other types of bone cysts under here. We're also going to get neoplasms by site, abdominal neoplasms, and then presumably types of abdominal neoplasms. So you can see that it is quite comprehensive. I like to show this to you for a couple of reasons. The first one is I think it's a really great tool. So if you realize that actually neoplasms and just cancer in general is too broad, I'm not that interested in all types of cancer, you can use this tree to find the more specific type of cancer that you are interested in. So maybe you might realize, actually, I just want to focus on abdominal neoplasms. Then you can move down to that level. Alternatively, you might realize that you started too specific and you need to expand. So let's say you started with bone cysts and then realized, actually, I'm interested in all cysts. You can always move up a level and then use the mesh term for cysts. So it gives you some flexibility, which I really like. The other thing that's great about the hierarchy, or not great, but is a part of the hierarchy and can be great, is that it automatically does this thing called exploding. What I mean by that is that if we search the mesh term neoplasms, we're going to get all the articles that have been tagged with neoplasms, as well as all of the articles that have been tagged with any of these subsequent terms. So we're going to get articles that have been tagged with cysts, bone cysts, all of the types of bone cysts, all of the types of abdominal neoplasms, all of the types of bone neoplasms, etc. Sometimes that's really useful. Sometimes it's really efficient to be able to get all these types of cancer really quickly. Sometimes that's really not useful. Sometimes you want to limit just to a particular topic. If that's ever the case for you, you can scroll up and select this little checkbox to not include mesh terms found below this in the hierarchy. That will limit your search just to the mesh term that you're using. So in our case, it would limit it just to neoplasms. So that is my overview of mesh. If you realize you have questions, this is kind of a big topic. So if you realize you still have questions, please use Ask Us to reach out to us. And we are happy to answer a quick question or meet with you to help you use mesh to the best of your ability for your search. But now that we also kind of have an overview of mesh, we're almost ready to start searching our demo search. The other topic I want to touch on before we do that is the idea of Boolean operators. So Boolean operators are the words that we use to connect our search terms together. When we are connecting things within a column, so things that are on the same topic, we're going to use the Boolean operator OR. This allows us to cast a wide net and find everything related to a topic. So in our demo question, we are going to find the mesh term for healthcare workers, and then we're going to say or the term healthcare worker, or health personnel, or health employee, any other synonyms we can come up with, right? That's going to cast a really wide net and make sure we're not missing anything. Once we've created searches for all of our concepts, then we're going to use the Boolean operator and to connect those searches together. That's what's going to both reduce the number of articles that we get and also increase their relevancy, because everything that is left will have to mention healthcare workers and masks and hand washing and hospital acquired infections. So these are the two Boolean operators that we can use, and you can kind of see how we're using them. We're initially using or to be broad, and then we will use and to narrow and focus. So that is where we are headed. So we're going to get started by searching for a mesh term for healthcare workers. So I'm going to return to mesh, and I'm going to type in here to the search bar, healthcare worker. And it suggests for me 3 different mesh terms. And when I look at this health personnel and read the definition, men and women working in the provision of health services, that matches what I think I want. So I'm going to go ahead and click on it. After I've clicked on my term, I'm going to come and look at that tree or that hierarchy and see what all is underneath it. Again, just to confirm that I'm in the right place. So I'm actually going to catch that other term that we saw, that allied health personnel, but I'm also going to catch things like anesthetists, caregivers, dentists, nurses, hospital personnel, physicians, including cardiologists, dermatologists. So this is quite comprehensive. And for the purposes of today's search, I kind of like that. So I like that it's going to explode and catch all of these specific types of employees in the healthcare field. So I'm going to scroll back up to the top, and we're going to use this PubMed search builder in the top right corner to build our search. You don't have to build your search here. You could directly just build it in a Word document or something like that. The reason I like using the PubMed search builder is it allows me to use buttons like this add to search builder button. So if I click on this button, it's going to pull my mesh term in with all of the correct punctuation and formatting so that PubMed will recognize it as a mesh term. PubMed is a very literal database, and it doesn't handle typos well. Google's an example of a smart database that can understand typos. It can kind of get to what it thinks you were looking for. PubMed is not very good at that. So my strategy for minimizing the risk of making a typo is to use a lot of copy and pasting and pre-built buttons like this one. So I've gone ahead and pulled in my mesh term. Now I want to complement that with some entry terms. So some terms that are going to search the free text fields, things like titles and abstracts, to make sure we're not missing anything. So the first thing I like to do is I like to grab this whole mesh term. I'm going to add that Boolean operator or, and then I'm going to paste in health personnel. So I feel like this is always a very confusing step. It feels like I'm searching this twice, but the benefit of doing it both times is this will catch mesh terms and this will catch entry terms. And it's the combo of the two that makes sure that I'm not missing anything. When something is a mesh term, again, we can't make any changes to it. It needs to be exactly like this for PubMed to recognize it as a mesh term. For entry terms, we can make little tweaks if we want to. So one of the tweaks I'm going to do is I'm going to add quotation marks around this to force PubMed to find health personnel as a phrase, as 2 consecutive words in that order. And that will so that health and personnel aren't like spread out in a sentence or something, right? I want it to be actually that phrase. I'm going to then add another or, and then I'm going to scroll down and look at this list of entry terms and see if there's any that I want to grab. I never search these comma inverted phrases like personnel, comma health, just because I feel pretty confident no one has an article entitled personnel, comma health. So I'm going to go ahead and ignore that. You'll notice that this next term, healthcare provider and healthcare providers, I think that's very relevant. And you'll notice that it has written out the singular and the plural. So those do matter in PubMed. If I were to just search healthcare provider, I wouldn't get the plural version. And if I were to just search healthcare providers, I wouldn't get the singular version. So what I'm going to do is I'm going to copy and paste the singular version. I'm again going to encase it in quotation marks to force it to find it as 3 consecutive words. And then the other thing I'm going to do is I'm going to add an asterisk. It's also called truncation. What this does is it says find the phrase or the words healthcare provider and then any subsequent characters. So that in this case, I don't think there's any other thing else that's going to be after provider other than an S. And so that is an efficient way of finding both the singular and the plural of healthcare provider. Alternatively, if the asterisk kind of freaks you out, you don't want to use it, you could just put in provider and then do an or, and then paste in healthcare providers with an S. Totally up to you. They're both going to do the same job. It's just a matter of personal preference. I'm personally a big fan of the asterisk. So that's what I'm going to do. And then I'm going to come back down and I'm going to grab healthcare provider where healthcare is 1 word. So this with healthcare being 2 words, it is not going to find healthcare as 1 word. Same with this, healthcare as 1 word is not going to find healthcare as 2 words. So we need to include both. I'm going to add that asterisk to account for the plural. And then I'm going to scroll back and see if I want any of these other terms. I think I like healthcare worker. That was the term we initially searched. Again, I'm going to use my quotation marks and asterisk. And then because they don't have healthcare worker with the iteration of healthcare as 2 words, I want to account for that. So I'm just going to paste it in again, and I'm going to separate out healthcare as 2 words. And again, put the asterisk and enclose the quotation marks. I'm going to come back, and the last one I see is healthcare professional. So I'm going to go ahead and grab healthcare professional, add my asterisks and say or, and then do it again with my asterisk and then account for healthcare as 1 word. I could then, if I wanted to, I could also add free text versions of some of those specific positions. So I could add in, anesthetist or physician or doctor or nurse. That's always an option. For the purposes of today's class, I'm going to leave it here. But again, I always want you to remember that you're not limited just to this list. You are absolutely empowered to add other synonyms that you think are relevant to that particular topic. Now, before I hit search PubMed, I'm going to copy and paste all of my terms into my search matrix. So you can copy and paste things into that Word doc that you have access to. And that allows you, again, like I said, to have a replicable version. It also, if you get invited to go out to dinner while you're in the middle of working on this, you're not going to lose any work. You can just leave it in that Word doc, save it, and come back to it later. So I've now pasted my search terms, so I definitely have them. And now I'm going to hit search PubMed. This is going to pull my search from the MESH database into PubMed. And we can see I'm getting a lot of results. I'm getting 815,000. It makes me feel pretty good that I'm not missing anything major on the topic of health personnel. And once I add in our other factors, I know that that number is going to go down. It is not humanly possible to look through all of those, but that's not our goal, right? Under the search bar, there is this advanced button. If you click on that, this will take you to what is called the advanced search builder. This is where eventually we will and all of our searches together. So, this is where we will end up. Again, I'm not leaving you with 800,000. We're going to use this tool later to bring our results down. It's also where our search history lives. So anytime you run a search in PubMed, it automatically gets sent to your search history. Your search history will stick around for up to about 12-ish hours, even if you were to close the browser. So long enough for this class, this video recording. So I'm just going to let our search sit here in history. And there's also a nice handy link back to MESH. So I'm going to return to MESH and flesh out our next search concept, which is hand washing. So I'm going to search hand washing in the MESH database. And in this case, up until now, when we've searched for mesh terms, we've been given a list of suggestions. This one took us directly into the record for hand disinfection because it was such a clear match. Still can't hurt to take a look at that definition just to ensure that we are in the right place. So the act of cleansing the hands with water or other liquid, that's what we want. I also then like to check out that hierarchy. And this is an example of a term that's the end of a hierarchy, the end of a tree. There's nothing underneath hand disinfection, so it doesn't matter whether or not I explode it, it's not going to catch anything anyway. So I'm going to scroll back up, and I'm again going to use that PubMed search builder. I'm just going to click add to search builder, and then I'm going to add our Boolean operator, or I'm going to copy and paste in hand disinfection with those quotation marks. I don't need to pluralize that, so I don't need to worry about the asterisk. And then I'm going to come down and I'm going to grab surgical scrubbing. That feels relevant. Again, encasing it in quotation marks. And then I'm also going to grab hand sanitization, encase it in quotation marks. And I'm going to grab hand washing and paste that in with quotation marks. They've added an option for washings. I'm skeptical there's anything that says that, but I'm also not worried about catching anything weird. So I'm going to go ahead and add the asterisk just in case. Again, I'm then going to copy that full list into my search matrix so I can come back to it later. And then I'm going to go ahead and search PubMed. And there's not a ton on hand washing and hand disinfection. That makes sense to me. It still is a lot, right? 9,000 is not how many you want to look through, but way less than 800,000. If I click on advanced, again, I can see that it's now in our search history. And now I'm just going to go ahead and go back to mesh, and I'm going to handle our next concept of our comparison of wearing masks. So I'm going to search for masks, and we get masks, devices that cover the nose and mouth to maintain aseptic conditions. That's what I want. I'm going to scroll down and see what's underneath. I'm okay with it catching these specific types of masks. So I'm just going to say add to search builder and then say or. I'm going to grab mask and take off that S and add an asterisk to account for the plural and the singular. There's no other entry terms. So this is an example of a time where I could add some more. So I might add face covering or N95, right? I feel pretty good about that. If this is your area of expertise, you could add even more if you wanted to. I'm going to copy and paste that into my search matrix. And then I'm going to search PubMed. And this is going to get a good number, 116,000. It's jumping ahead a little bit, but this is a point where I want to show you one thing that's kind of cool about PubMed is that it will give you this nice graphic of results by year. So the oldest result in these 116,000 is from 1829. The most recent one is from this year. And you can see when the bulk of articles were written. And so obviously in the wake of COVID-19, we got a huge spike. So it's just kind of cool to be able to see trends of like when something was popular, or just also the steady growth of scientific literature. But anyway, going back to searching, under the search bar, if I click on advanced, you can see that this is also in our search history. And again, I'm going to return to mesh, and we're going to work with now hospital-acquired infections. When we are searching for hospital-acquired infections, we're just going to search the noun. We're just going to search hospital-acquired infection. We're not going to mess with the verb, the idea of reducing. That's for a couple of reasons. Verbs like this can often be really tricky. There can be lots of ways of talking about them. The other thing is that if there's an article out there about healthcare workers who wash their hands instead of wearing masks and it increased hospital acquired infections, I think we want to find that. Like, I think that's worth looking at. Just because it didn't reduce it, it still had an impact on hospital acquired infections. And so that's why we don't mess with kind of like qualifiers. We're just going to search hospital acquired infection. So I'm going to return to mesh and I'm going to search for hospital acquired infection. This is another example of one that took me directly into the record for the mesh term of cross infection. So any infection which a patient contracts in a healthcare institution, that's what I want. I'm going to scroll down and again, take a look at what's underneath in the hierarchy. We've got some like pneumonia. I'm cool with catching that. So I'm going to scroll back up and I'm going to click add to search builder. I'm going to say or, and then bring in cross infection. I'm going to encase it in quotation marks. It also couldn't hurt to add an asterisk if there's infections. I'm going to look down here. We've got infections covered. I'll grab healthcare associated infection. Add that asterisk. Then I can see we also have healthcare associated infection where healthcare is 2 words. So that's good. We'll account for that as well. Do an asterisk. And then we'll also grab hospital infection. Add an asterisk. Expand this. Gonna grab this one. Put in quotation marks, add the asterisk. And I think we've now accounted for all of these iterations. If I wanted to add some more, I could. For now, I'm just going to copy and paste into my search matrix. And now I'm going to go ahead and search PubMed. And here you can see we get 83,000 results. Now that we have all of our components, we have all of our individual searches. They've each been created, they've each been searched, they're all in our search history. Now we can combine them together. This is my favorite part because it makes it actually about our question, and it also allows us to use the advanced search builder. So down here by our search history, for each of the entries in the search history, you'll see there are these 3 little dots. So if I click on those 3 little dots, I can say add query. And that's going to move our query up into the query box. If I do that for our second search for hand washing, you'll notice I now have some options. Now I can add with and, or not. Up until now, we've used or to be really broad. Now we want to use and to find the crossover. So I'm going to say add with and, same with masks. I'm going to say add with and then for cross infection, add with and. If we look up at our query box, we can see that PubMed has done all the work for us. So it has added all of the necessary parentheses. Again, I mentioned earlier that PubMed, if you just miss even one little punctuation mark, it can really throw off your search. So by using the advanced search builder, I'm putting the onus on PubMed to put the parentheses in the correct place. It's much less likely that it makes a mistake than I do. It also added all of those ands. So it's all connected together correctly. And so now all I need to do is hit search. And fantastic. So now I have 26 results. So that's a number that you can physically go through. It's not 800,000, right? And we can see that they're on the idea of hand washing, about hospital acquired infections, looking at masks and hand washing. So this is what I want. They're actually on my topic. While we are looking at results, you might be noticing that this results page might look a little different than yours. So if you come to display options, if you click on display options and you come to the format, yours is probably defaulting to a summary format. I recommend changing that to abstract. Abstract allows you to see all of the abstracts, which I think is a time saver. It makes it a little bit faster and easier to assess whether or not an article is actually on your topic or not. The other thing you'll notice that might be different from your screen is that our keywords are being highlighted. This is a benefit of having what is called a My NCBI account. So I am currently logged into my NCBI account. If you would like to create a My NCBI account, there is a link to a video on how to set up an account under this video. And so you can set up an account. It's free. And one of the benefits of having an account is being able to set up this search term highlighting. So if you go off and you create an account and you'd like to get some help creating that search term highlighting, please go again, use the Ask Us tab, reach out to us, and we'd be happy to walk you through how to do that. The other thing I want to show you, there's several things actually I want to show you about managing results, but before we do that, I want to wrap up our search talk and say that one other benefit of the way that we've kind of structured our search is that it becomes very easy to do different iterations of this search. It is not uncommon when you have a Pico search to drop either the comparison or the outcome to, again, make sure you're not missing anything. So if we wanted to, let's say we decided to drop the comparison of masks, we don't have to do all this work of like finding all the terms and deleting them and redoing the parentheses. We can just add to query health personnel, add with and cross-infection, or sorry, hand washing, and then add with and cross-infection. And then just like that, we suddenly now have a broader version of our search that has 1,100 articles. And we can, again, make sure we're not missing anything major. So that is one thing that's really nice about using that search method. So now I want to focus on how you can manage and utilize your results. So over here on the left, you'll see there is this results by year that I kind of pointed out earlier. You can, in addition to seeing when things were most popular, you can also limit based on years. So if you only wanted to read things from the last 5 years, you could use the slider to create that limit of the last 5 years. And then you'll be able to reduce that number. So now 188, that's much more reasonable if you were to actually scroll through and look at all of those. So now, in addition to using that results by year, sometimes people will ask me about this filter over here for text availability. While you're affiliated with CU Anschutz, don't use this. We subscribe to so much, we can probably get you a lot. Even if it's not free to the public, we've paid a subscription to access it. So don't limit yourself this way. We subscribe to so much, we'll be able to get you access to so much. And then in a second, I'll show you, even for things that we don't subscribe to, we can get it for you most likely with interlibrary loan. So while you're affiliated with Anschutz, don't use this text availability. However, like I've mentioned before, if you graduate, you move on to somewhere else that maybe doesn't have quite so many subscriptions, you can still use PubMed, and then you can limit to free full text. So the things that are available to the public. So that's a pretty great ratio. 120 out of 188 are free to the public. So if you are, at an institution that doesn't subscribe to very much, using that free full text is a good way to limit to the things that you can access. And it's really great that there's a growing number of things that are free. So that's how I would recommend using that filter. Don't use it now, but know in the future that you can use it if you're not affiliated with an institution or something like that. Next, we have this article type filter. So these filters allow you to focus in on a specific article type. So we can see if there is a randomized control trial. There are 4. The caveat I have with using those filters is that they are built on mesh. We've established earlier in the class that not everything in PubMed receives a mesh term. So if you use that filter, you can only say with confidence that there's a minimum of 4 RCTs. There could be more, but because they don't have that mesh term, the filter can't catch them. So I don't think it's wrong necessarily to explore a result set using those filters. However, you just need to have that in the back of your mind that you could potentially miss something. So just know that when you use those filters. There's also then a pre-built filter for particular date ranges. This is going to be slightly different than this slider. So this slider is more broad. This is going to do January 1st, 2018 until today. This one, if you were to use the pre-built filter, it's going to do, I'm recording this on August 9th. So it would go back to August 9th, 2018 until today. So it's more exact. I always like to point that out to people just because if you use this one and then you use this one and you notice there's a different number, there's a reason for that discrepancy. So those are all of the different filters. The other things I want to show you are you can save this search. So if you want to save these search terms, if you click on create alert under the search bar, this is dependent on having a MyNCBI account. So first you'll need to have an account, but then once you have an account, if you want to save these search terms, you can hit create alert. You can name it whatever you want. Don't mess with your search terms because you just worked hard on those. And then you even have the option to receive email updates anytime something gets added to PubMed that fits the criteria of this search. You can get an email update letting you know that there's something new on this topic. So I think this is really useful if you're a faculty member and you have a particular research area. You can put in the upfront work of putting together that search, but then you can passively get emails whenever something gets added about your topic. Same with if you're a PhD student or someone who's doing a lot of research in a particular area. I think that this is a really smart use of your time to put together a search and then set up that search email. And you can customize when and how frequently you want to receive those emails. And this is something also that you can create a consultation with the library. We're happy to help you set one of these up because I think they're a really great use of your time. So that is create an alert. The other thing you can do is you can send to what's called a collection. So this is also dependent on having a MyNCBI account. But so you can select either all the results on this page. I think I have mine set to do 10 per page. I could do all results, so all 188, or I could do a selection. You'll notice there's a little checkbox next to each article, so I could select the ones I want to save. And then I could either add to an existing collection, or I could create a collection called hand washing, and then add the articles that I want to that collection. So this is going to be a static collection. It's not going to save your search terms. It's just going to essentially be a collection of articles that you want to come back to. One thing that's also cool about these collections is that you can share them with others. So these are, again, both tied to your NCBI account. So I'm going to show you where you can go to view them. If you click on your username in the top right, and then click on dashboard, up in the right, you'll see your saved searches. So any searches that you've saved, if you click on the search, it will run the search with the terms that you put together. Below saved searches, we have our collections. And so this is where you can see our collection of articles. It will default to being private, but if you click on this little gear, you can change it to public, and then you can share a URL with others. So that's where I was mentioning you can share things with others. Another thing you might want to do is you might want to send your articles to a citation management software, something like EndNote. If you want to do that, you can select the ones that you want to download. So let's say you want one which has a huge abstract, and then 2. Then you can hit send to Citation Manager, send those selections. You could, if you wanted to, instead of selecting, you could do all the results on this page or all of the results. The limit on all results is 10,000. And then you can hit create file, and it will create what is called an NBIB file, which you then can open into EndNote. So that is how you can get things into EndNote. Other things that you might want to do with your results, you can also email them to yourself and things like that. The next thing I want to show you is how to get access to full text. So we're going to scroll, and under the abstract of articles, you'll see this Strauss Library article linker. This is going to summarize all of your access options. And once it loads, you'll be able to see that this is available. This one is actually a book, and it's available on this NCBI bookshelf. So I'm going to click on that, and I can see that here's the book, and I can look at it chapter by chapter. So that is one way to access things. If you find something you want to read and there's no full text available and there's no link on the top half of this white box, that means we don't subscribe to it. But like I mentioned earlier, we can still probably get it for you using interlibrary loan. So under additional services, if you click on interlibrary loan, then you can request it. I think this isn't showing up since this is an NCBI book. Let's look at another option. So let's look at this one. So this one, again, I think we're going to have it. So you could get it through Elsevier, but imagine we didn't have it. Then you could click here for interlibrary loan. You can log in. If you've never used interlibrary loan before, you probably don't have an interlibrary loan account. That's a-okay. You're just going to click on first time users and it will walk you through creating an account. It's free, it's very simple. And then once you have an account, you can just log in. The beauty of initiating an interlibrary loan request from this page is that all of the required information is filled out for you. So you don't actually have to do any typing. You're then just going to hit submit request, and then a call goes out to all the libraries that participate in interlibrary loan. One of them will scan and upload the text for you. So that's a really great service. And again, really broadens your access to things so much more than just the things that are free on PubMed. So definitely don't hesitate to using that. It's going to be free 99% of the time. If there ever was going to be a charge, Lynn, our interlibrary loan coordinator, would email you and say, turns out this is $7. Do you still want it? At which point you could say yes or no. So there's never a risk in placing a request. We're never going to charge you without asking. So that's how you can get access to things in PubMed. And I think that covers most of the features that I wanted to go over with you. If there are other features you'd like to learn about, or if you have questions about the features that we just went over, please don't hesitate to reach out with the Ask Us button. We really want to be able to help you. And that's what the next slide is about. Please ask us for help. And other than that, I do want to say thank you so much for coming to watching this video. I hope it was helpful. This is one of our first class recordings that we're making publicly available, and we would love to get your feedback on this class. So there's a link to a survey below, and there's also a link to the survey using this QR code. So if you want to use your phone, it's just a couple of really quick questions letting us know what you thought of this asynchronous class, and we would love to get your feedback. So again, I just want to say thank you for watching this video. I hope it was helpful, and please reach out to us if you have any questions. Have a great day.